Hi, everybody. Judy Maggio with Austin PBS. We are working remotely, as many of you are, but we're trying to keep everyone updated on the latest developments with this pandemic that's impacting our country and certainly our community. One of the things we're doing is checking in with our local nonprofits to find out what they need during this difficult time. So joining us now is Nick Canedo with the nonprofit We Are Blood. Thanks for being with us, Nick.
Thank you for having me.
Well, first of all, give us the big picture. How has COVID-19 and the fact that so many people are social distancing now and working remotely and changing their way of life, how has that impacted your work there at the Blood Center?
Well, We Are Blood is the blood center serving Central Texas, and we supply blood to over 40 hospitals and clinics within Central Texas. So we're talking about places like Dell Children's Hospital, Dell Seton, St. David's North, St. David's South. So all the major hospitals in our area are relying on blood donations for patients who need transfusions to live. We collect donations through mobile blood drives and at our 3 donor centers. And our mobile blood drives are relied upon to collect around half of the blood donations we need to meet the need of patients in our area. And what we've seen over the past month, and especially within the last few weeks, are multiple blood drives being canceled as businesses are adopting work from home policies and new building access policies, and communities are being asked to practice social distancing, which is limiting the amount of outings that everyone is doing in Central Texas. We've lost at least 20 different mobile blood drives over the past few weeks, representing 800 to 1,000 blood donations that we need for our community. And we're just right now urging the public to come out and donate blood. Visit us at weareblood.org. And donate at one of our centers or one of our still active mobile drives to kind of build up our stock and prepare for a looming secondary health crisis.
So I'm sure that people watching are concerned about their own safety. And I also am certain, because I've been to We Are Blood, that you have so many safety measures in place to sanitize and keep things clean there. So talk about the extra measures that you're taking there at We Are Blood so that people can feel comfortable if they come in and donate blood, because I know this is going to be a big need as more and more people become ill in our community.
Thank you for bringing that up. Yes, as a medical facility, we always keep a high level of high standard for how we clean our facilities, but we have elevated those standards in the past few weeks to respond to people's concern about exposure to coronavirus. So right now we're cleaning our donor center, including our donor waiting room and our canteen area where people recover and have snacks before leaving after donating once an hour. But our donor beds and our interview booths where people participate in a self-questionnaire and utilize one of our computers, those are wiped down after every donor. So we're trying to elevate those practices. We're also at registration, when anybody walks into one of our donor centers or one of our mobile drives, they are instructed to utilize We Are Blood provided hand sanitizer before they start touching anything, before they sign in to register, before they get on one of our computers to participate in the questionnaire. And that way we're controlling that a little bit as well.
Is there any indication yet, and this is very early stage, as we record this, we've had, I think, about 10 cases in Central Texas. We know those numbers will escalate. What kind of demands will that make on the medical facilities that you provide blood to? I'm guessing this means that more blood is going to be needed in our community, much more.
Well, we're not particularly sure exactly how the demand will increase as more corona cases are confirmed in Central Texas. But what we do know is that we will no longer be able to meet the minimum threshold of what hospitals already need if we continue along the path that we're seeing with canceled blood drives and increased social distancing that might dissuade people from donating blood. Just today, Mayor Adler talked about issuing a call for non-essential services, so people to stay from non-essential businesses, but we're within that sphere of what's defined as an essential business when it comes to being a healthcare organization. So people can think of us as a necessary essential service that they're visiting as much as visiting a grocery store or visiting your doctor. Coming to donate blood fits within that sphere rather than going to socialize at a bar or a restaurant. So that's really what we're trying to help people understand. Another concern that we've heard from the public is, what if I have coronavirus and I don't know and I donate blood and that blood is used by somebody else? And what I can share to assure people of that is that The FDA has found no evidence that the coronavirus is transmittable via blood transfusion. So not in specific around coronavirus, but the other thing is that a coronavirus is an upper respiratory viral infection, and there has never ever been any cases of an upper respiratory viral infection being transmittable via blood transfusion either. So in specific and in general, we just haven't found that blood transfusion is a way that is transmitted.
So it sounds like there's so many different ways you're keeping people's safety in mind and have thought about the different protocol and making sure that people know that it is a safe space, it is a clean space, and it is a place that they can go to reach out and help the community during this really difficult, uncertain time. Anything else, Nick, that you would like for people to know about the needs of your organization for the next several weeks and months as we start more and more of us staying home and working remotely?
Well, if you're feeling cooped up at home and you're doing the right thing by staying home and staying away from social outings, but want to give back to your community and feel like you're making a difference, coming out and donating blood is a vital way to do that, in a way that you can also feel that you're still protecting yourself. So donating blood now will make sure that our community is prepared for any further measures that the city, state, or national government needs to take, whether they want to recommend a quarantine or anything like that in the future, which will reduce our capacity to collect blood. That's really what I want to hit home. Donating now will have a real impact for your community and will help keep Central Texas safe.
And we all want to keep Central Texas safe. Thank you so much, Nick Canedo with We Are Blood. And we are compiling these interviews not only on social media, but we have a brand new website, Decibel ATX, where you can go as a great resource for the very latest on the COVID-19 pandemic that's impacting our country and our community. Thank you so much, Nick. We appreciate it. And we appreciate all of you watching today.
Thank you, Judy.